here, everybody. How you doing? My name is Regina MSNRN, and I am so happy that you are on the live class. You made it. Tonight is Winning Wednesday. We already have over 300 nurses here to study. Our topic for tonight, you're going to love it. It's allergies. It is general allergies. And we're going to cover a spectrum of things that our patients can be allergic to. This is a very important topic. If you're on the road to passing your NCLEX exam, shout out Florida in the house. I see you. Connecticut, all over the nation. It's Wednesday. Let's go. So allergies, what do we know about them? What do we need to know about them for the exam? We need to know this. Allergies are a reaction of the immune system from a substance, and that substance can be many different things, but atopy is the genetic tendency to develop allergies. How many people have allergies here on tonight? And did you get them from your mother? Did you get them from your father? Who has the allergies? And what things are you allergic to? It might be something we're covering. I see you on tonight. Let me know your allergies. This is a community. We're getting to know each other more. I want to get to know you. All right. So when atopic people are exposed to allergens, they can develop an immune reaction that leads to an allergic inflammation. Oh my goodness, an allergic inflammation. And that's kind of what we're expecting with allergies. So anyways, the causes of allergies range. They range. So I see some people here, they're allergic to pollen, shellfish, dust, allergic to ants. Wow. Oh my goodness. Yes, the seasonal allergens, dust mode. I see you, T-Rob, on tonight. Thank you, Veronica, as well. Bees, allergic to bees, Vanessa. So food, you can have nuts, shellfish, some of the ReMar nurses here. Allergic to milk, lactose intolerance, bananas, kiwi, chestnuts, eggs, and wheat, okay? Plants as well, poison ivy. I feel like everybody's allergic to poison ivy, poison oak, poison sumac. These are things that are going to cause an allergic irritation. What about you? Corn, Amber, corn, allergic to corn? Okay. Insects, bee stings, hornets, spider bites as well. So our patients can have many different allergies, particularly on NCLEX. We know we have to know the medication allergies. So those who are allergic to PCN, sulfa, and some anesthetics can also cause a patient to have an allergic reaction. Chemicals, latex, perfumes, and other chemicals as well. All right. Airborne, dust, animal dander, cats, dogs, pollen, mold, and mildew. All right. Hey, guys, I am so happy that you are here today studying this topic with me. I got a ReMar nurse. Shout out, nurse Remy says, I passed my NCLEX last Wednesday, July the 12th. I give glory to God, and I'm thankful to you, Regina. Congratulations. Let's clap it up for Nurse Remy, who passed her NCLEX. That's a major milestone around here. We are taking time to celebrate you because I have some people that are going to be next. They are going to be next. All right. Congratulations. Shout out to everybody in V2. You know what to do. It's Winning Wednesday. All right. Signs of allergies and an allergic reaction are asthma, shortness of breath, cough, chest tightness, and wheezing. All right. Itchy, watery eyes. Yes, I've had that before. Itchy, inflamed, or runny nose. Dark circle under and around the eyes. Reoccurring headache, diarrhea, or stomach cramps. Okay. And did you guys see that the gastrointestinal issues are not always related to, or they're not always recognized as an allergic response. So we had people in here that say they were allergic to dairy, they were allergic to corn, they're allergic to cabbages, whatever. And you can see that you can have an allergic reaction. It's just not always like upper respiratory things. It can be your gastrointestinal system too. So make sure that you are remembering that point. Okay. Reoccurring headache, diarrhea, or stomach cramps. Signs of an allergic reaction. Whenever we're talking about a condition, we always want to look at the emergency. So yes, the allergies is an issue. Anaphylaxis is an emergency. And so we have to know about that. Signs of anaphylactic reaction are breathing difficulties. That's the number one thing. And while we're talking about it, go ahead and give me the antidote for this. What are you going to give your patient? Severe wheezing, confusion, rapid or weak pulse, slurring of speech, heart palpitations, fainting or severe dizziness, cyanosis, generalized hives. Come on in, 530 nurses watching on a Wednesday. Wow, amazing. And like I said, when we're talking about allergies, don't just think that it is nose, ears, sinuses, and throat. Don't just think that. There are other areas of the body that are going to be affected. Lung and chest, stomach and bowel, and the skin. All right. Take it all in. And we have also, this is important for NCLEX, type of people who are most likely to develop latex allergies: healthcare workers, hairdressers, mechanics. Latex allergies are big for the NCLEX exam. So how do we manage it? Well, you can give a medication class called a antihistamine. Antihistamines are going to block your immune response. So they block histamine release from the mast cells, reducing your irritation symptoms. Intranasal corticosteroid nasal spray. That's a lot there. But if you have a nursing background, it is so simple. Okay. Intranasal corticosteroid, we know that is a steroid, and it is an effective treatment of moderate or severe allergic rhinitis. Now, why would we give a steroid? What is the steroid going to do for the patient with rhinitis? Why would we give a steroid? What are we expecting? What are we going to teach that patient will happen if they take these medications? Okay. Shout out to Janet while I'm waiting for the answer. FYI, I passed NCLEX PN. How many people are getting ready for the PN exam? This is how Janet passed. Because of you, Regina. Thank you so much. V2 was awesome. Now on to the next test. Thank you, Janet, so much for coming on here on Wednesday. You guys are overflowing me with the testimonials too. I appreciate everybody going to remarnurse.com and giving their testimonial for their free gift when they pass with V2. Please, Janet, check out remarnurse.com/party. Here it is on the screen. If you pass with V2, you need to go to this site. You need to go here. Because this is the season for you. All right. So I see what you guys are putting here. Thank you so much for answering that question. I asked, why do we give corticosteroids for rhinitis? Why do we give them for allergic reactions? To reduce the steroids. Yes. Okay. Combination therapies of the INCS. Okay. And also antihistamines. This is used for treatment of moderate to severe allergic rhinitis, and it offers advantages of both medications. Okay, so that's a good combination therapy. Medicated eye drops and adrenaline epi used for first aid treatment of life-threatening severe allergic reactions. I saw you guys put that there. Good knowledge to have. If you're a nursing student, you need to mark that down. Okay. Non-medicated treatments. This is over-the-counter things that do help with allergies. If you have allergies, you have more than likely purchased one of these things. And essentially, the non-medicated treatments is the saline spray used for allergic rhinitis and sinusitis, and or allergen immunotherapy. This is a long-term treatment which changes the immune system's response to allergens. You do not have to know about that in detail at all. You should know the term allergen immunotherapy is going to address how the immune system responds to allergic situations. Okay. Wow. Here are our nursing considerations. Our nursing considerations are this. Clients have to know what they're allergic to because the environment is so big. So a client should have an allergy test. Usually they do them when you're a kid. If you begin to have problems, they say around 2 to 5 years old, depending on your pediatrician. Okay. Assess allergies for clients before giving any medication. We know that should be done. Observe the client for any allergic reactions to given medications for at least 15 minutes. It's the same thing we do when we're giving blood. You know, if you give blood to a patient, you need to stay with that patient for 15 minutes. I guarantee you that is going to be on somebody's exit exam. Somebody's exit exam, you're taking HESI, you're taking ATI. You need to know the information about giving blood to a patient. If you want to prepare for your exit exams, I'm telling you, do an NCLEX review because that NCLEX review is going to go over all of the nursing considerations. And then, of course, allergies should be documented. If we find out a client has an allergy or even a possible allergy, should be documented. All right, is it time? No, not just yet. We have some more nursing considerations. Monitor the patient's vital signs. That's part of staying with them. Encouraging patients to continue their medication. Some medications for allergies cause side effects, right? Some medications for allergies cause side effects. If you know some of those side effects, put them in the comments right now. How can they make a patient feel? How can your patient feel after they've taken allergy medication? And so when they take the allergy medication, because they have these side effects, then they don't want to continue on taking them. All right. Because every medication is going to have some side effect. And sometimes the side effects are worse than the actual cause. Like they're worse. And so, yes, Keisha says dry mouth. Yes. The drowsiness. Oh my goodness. And so if you've ever taken some allergy medication, you can hardly stay awake. You're tired. You have to go to bed. And so that is one of the reasons why a lot of people don't take allergy medicine. Okay. Another thing, this is about allergy medicine. This is a administration point. When do we typically give allergy medicines, or when should we encourage our patients to take allergy medications? In the morning or in the nighttime? What do you guys think? What do you think and why? This is a good question. When do we typically give our allergy medicine? Okay, I see the answers on the screen, but why is that? Why do we give them? Are you guys reading the comments? They're really good. You guys know so much this Wednesday. Okay. And if you didn't know it, guess what? You're here to learn. We are giving allergy medicine at night. Yes. Now, why do we give it at night? To prevent falls. Okay. Falls risk. They make you sleepy. They do make you sleepy, but that's not why we're giving them. Okay. Remember, we're not giving them to put the patient to sleep. No. Whenever we're talking about a benefit for the patient, we want to stay focused on how it's going to help the patient. Because if we tell the patient, oh, we're giving this allergy medicine to you because it'll help you sleep at night. Oh, we're giving this allergy medicine to you because it'll help you from falling. The patient's going to be like, I don't have a problem sleeping. I'm not taking this. Okay. Or they're going to say, I don't fall down. So why would I take this? All right. So we got to think of the actual, and this is critical thinking. This is how people look at an NCLEX question and not get it right. All right. So we got to think critically. We're not giving it to them for safety. We're not giving it to them so they don't drive or anything like that, but so that when they are actually in the environment, they have the help to be in contact with those allergens. Okay. That's the reason why, guys. That's the reason why. It don't have anything to do with safety. It doesn't have anything to do with safety. It is because we want that patient to have time to get that medication all through the bloodstream. So it's all through the bloodstream so that when they go out into the world, they are able not to have a response. Does that make sense? Okay, I'm going to try to ask y'all questions like this about just allergy principles, because I think sometimes we get familiar with things in nursing or nursing school and we be like, oh, we know it. That's too easy. Think about the subject allergies. It's an easy subject. No, it could be a very challenging topic, especially if you are not reading critically. It could be challenging. So let's just put on our critical thinking hats, even though this subject is pretty straightforward. So we are encouraging our patients to, number 6, complete their medication compliance because, like I said, the side effects will be prohibitive for a patient to take this medication. Environmental control for clients and family. Yes, clients with allergies to iodine, shellfish, we are telling them, hey, you should probably not receive an IV contrast dye. All right. So we are also just making sure we're aware of the safety parameters. Here we go. We got questions. Put your comments on the screen. Almost 700 people. Oh my goodness. On the planet here right now. Question number 1. Angela, a 7-year-old cancer client, has reported to have an allergy to latex. In the hospital, she was served hot meals. Which of the following foods should the nurse be concerned about? Chestnuts, apple, blood pressure cuff, IV tubing. We're talking about a patient here with a latex allergy. Pick one that the nurse should be concerned about. What are you guys going to say? Put those answers on the screen. Latex allergy. What are you concerned about? Answers are rolling in. Answers are rolling in. I got nurses all across the nation studying. And I got answers all across the nation. And I'm confused right now. I'm confused at the answers on the screen because this question is pretty straightforward. It really, really is. And if you got this question wrong, it is simply because you not taking, I can't even explain it. Okay. So I love y'all. Everybody here. You are here for a reason. Okay. This is a study group. This is an intense study group. Okay. So let me reveal the right answer. And if you got it wrong, you hear. Okay. Correct answer is chestnuts. There could not have been another correct answer, guys. Remember, you are there to prove to the NCLEX exam, number 1, that you can read. You have to be able to read. Okay. And then you're there to prove that you could be a nurse along the way, somewhere along the lines. But if you are not reading, if you are not slowing down and taking your time, you will struggle with this test. You will struggle with this test. You have to read the question. Okay. And the next gen NCLEX is a lot more reading. So 7-year-old, what did I ask you? Which of the following what? Foods. Now, this is an example of how on NCLEX, you will have several right answers. Okay. You will have several right answers. Yes. Blood pressure cuffs have latex in them. IV tubings have latex in them, but they are not foods. So they're not going to be right. I said hot meals. I said hot foods. Okay, guys. So you got to slow down. Too many people got that one wrong. Too many of us got that one wrong. All right. But this is why you come here. You're here to challenge yourself. Okay. You're here to challenge yourself. We got to slow down. All right. Question number 2 is this. Here we go. Woo. Nurse Anna is preparing for an epidural procedure for a client. She informs the nurse that she is allergic to latex. Which of the following common equipment contains latex? Choose 2 options. Okay. choose 2 options. Number 1, tourniquet, 2, indwelling catheter, 3, cardiac monitor, 4, syringe, 5, oxygen flow meter. Okay. And I got to pause for the cause. Wait a minute. Wait, guys. Too many testimonials coming in. I got to stop. Hold the phone. Tracy passed the NCLEX exam. This is huge. This is Winning Wednesday. Hi, ReMar family. She says, I took the NCLEX RN on Saturday and I found out on Monday night that I finally passed. I graduated from nursing school 20 years ago and tested 5 times. I am a ReMar RN. Yes, you absolutely are. Congratulations. Thank you so much for coming back 20 years ago. I am speechless. I am speechless because that is such a long time to be patient, to be steady, to be putting it down and coming back up. You know, testing 5 times. There's somebody out here that's only been out of school for 20 days and they feel like giving up. They don't want to do it. They don't want to study. So you coming on here and saying, I've been out of school for 20 years. It's a testimony somebody needed. It's a testimony somebody needed. And I am so proud of you. We are all just saying, congratulations, Tracy. You indeed have done it. You have your license. You're a ReMar nurse. So amazing. I gotta press on because we have even another one. Grace says, hi, Regina. I passed NCLEX RN with ReMar. I'm an international trained nurse, graduated in 2009, over a decade ago. Thank you so much. My favorite words ever. I love to read. I'm officially a ReMar nurse. Oh my goodness. Now listen, I need y'all to know that these are real people. Maybe one of them is brave enough to come on here, but unlike other NCLEX reviews, I'm telling you, we never have to fake our testimonials. We never have to fake these comments. We never have to fake these congratulations. And I am just so appreciative of the authenticity of this community. You did it. Nurse Karina says, I passed my NCLEX on July 11th. Thank you so much for all your help. I am so proud of you, Karina. I am so happy for you. I am so happy that you come here and you just take your time out after you graduate, after you pass NCLEX, and you just let us know on Winning Wednesday, you know, on a random July Wednesday night that you had one of the biggest moments of your life. It's just like, you know, when somebody has a baby, when you have a baby, you're just so proud. And the what you really want to do is rest. You really don't want to talk. You don't want to do anything. But you guys, after this huge milestone, this huge delivery, you pick up the strength and come back and report that you passed when you don't have to. You don't have to, but you just are, you guys are just so amazing. Congratulations. Congratulations tonight. Wow. That's it. That's Winning Wednesday. Just catch this vibe because it's a vibe right now. I got to get back into the questions. I have to transition, but indeed, to God be the glory. Thank you so much. And I always say this, but I'm literally wanting to know who's next because I know that Tracy, I know that Karina last week or 2 weeks ago were right where you are. And they were here studying because you have to be here studying to know when to come back to give your testimonial. So literally, who is next? Who's next, Marie? Oh man, Rose, I'm speechless, y'all. Y'all do it to me every time. You flood me with the oh my goodness. Okay, here we go. Let me get back into it. Okay. Okay, so Nurse Anna is preparing for an epidural. Can we get back into this, guys? Okay, Nurse Anna is preparing for an epidural procedure for a client. She informs the nurse that she is allergic to latex. Which of the following calming equipment contains latex? All right. Number 1, I had said tourniquet. 2, indwelling catheter. 3, cardiac monitor. 4, syringe. 5, oxygen flow meter. I do see the answers on the screen. I ain't gonna hold y'all because you got them right. Correct answer is 1 and 2. 1 and 2. 1 and 2. The common hospital equipment that contains latex, tourniquet, indwelling catheter, blood pressure cuff, gloves, stethoscope. Ooh, I got to move on. Question number 3. Here we go. Miss Simpson is rushed to the emergency department due to a severe allergic reaction. The client has difficulty breathing, slurring of speech, and is having a weak, thready pulse. Which of the following medications should the nurse administer? Is it 1, lidocaine, 2, atropine, 3, epi, 4, 50% dextrose? Slow down and read, take a breath, pick your answer. That's it. That's how you have to approach these questions. It's not about doing 100 a day. It's about doing 1 right 100 times if you can get to 100. But literally, the amount of questions you do is nothing if you're not reading them correctly. All right. Listen, guys, follow me, never lose me. Correct answer is epinephrine. The client that is experiencing an anaphylactic shock reaction, we talked about this. Epinephrine is the first and most important treatment for anaphylaxis. It should be administered as soon as anaphylaxis is recognized to prevent the progression to a life-threatening symptom. Okay, here we go. Question number 4. The nurse is about to administer penicillin 50 milligrams IV to Mr. Sandro. He speaks to the nurse and informed that he is unsure if he was allergic to any medications. What is the best nursing action? Number 1, hold the medication. 2, give other antibiotics. 3, inform the pharmacist. Okay. 4, administer it and wait 15 minutes. Okay, so this is a situation, guys. Ooh, I love this situation too because it's safety. It's a safety thing. The patient is ordered penicillin. Okay, the patient is ordered penicillin. Now, he says, I don't know if I'm allergic to it. What should the nurse do? I see the answers is between 1, 3, and 4. What's the safest thing to do? Number 1, hold the medication. 3, inform pharmacy. Or 4, administer it and wait 15 minutes. Now, if you've been hanging with me for a while, this is something that we do frequently. I swear I do a question like this once a month. And I always go back to this principle because this is something that the most natural thing that a person would do is not right. But to a trained nurse, then it's right. Okay. Correct answer for this is number 4. How many people got that one right? It is number 4. And that is actually to go ahead and give it and then wait 15 minutes to stay with the patient. Okay. Because the rationale is number 1, the doctor ordered it. Okay. And then 2, the patient doesn't know if they have an allergy to it or not. So this is not a time where you would be like, I'm not going to give this medication. Because then what? What are you going to tell a doctor? Like the patient think they may be allergic to it. And then the doctor is going to say, okay. And if you don't give the treatment, that means the patient continues to have the bacteria for a longer time. You can't just not give a treatment because the doctor can order a different antibiotic. And the patient says, well, I don't know if I had that one. And then what are you going to do? Ask for another one and then ask for another one. Okay. So the patient not knowing is not preventative of you administering a possibly life-saving treatment. Okay. It's just like blood. You know, when a patient is ordered blood and we ask, hey, have you ever had any complications with blood? And they say, well, I don't know. I never had blood before. Guess what? They're getting that blood. They're getting that blood right then and there. I'm going to give it because If you ever have complications, we're going to find out tonight because blood is ordered and you need it. All right. So we have to think about it in terms like that. That's why it's always good to do an NCLEX review at the end of nursing school, because this is a point you might have missed it. All right. I am so proud of you guys that are tracking with me and getting these answers right tonight, because this is tough. See, you guys thought allergies was going to be an easy subject. Oh, I'm just going to sit here and listen. And I got y'all sweating in the spirit. All right. Got to get these questions right. Question number 5. The nurse is educating the community which client population is at most risk for developing a latex allergy. Okay, number 1, the homeless population. 2, artists. 3, hairdressers. 4, car salesmen. Let's go, ReMar nurses. Get these comments on the screen fast. We got to move. We got to move on tonight. It's Wednesday. Okay, this is a power session. We already been going for 35 minutes straight. I'm tired. Who can keep going though? Okay, correct answer here is going to be, I think we're all on one accord right now. Correct answer, tap in everybody, is number 3. It's number 3, the hairdressers. Okay, we got that one. All right, and that is because the more you are exposed to something, the more likely you can develop an adverse reaction to it. And so for healthcare workers, many of us in nursing school, we had no issues. We had no allergies. We had no MRSA. We had no C. diff. We had no problems. Hey, how about this? We had no anxiety. Some of us had not known what anxiety was until we started nursing school. And then what happens? The more we're exposed to something, the more we get it. You never had test anxiety until you got to nursing school. You were free as a bird until you got to nursing school. You never had a latex allergy. You never had a problem with your stomach. But then nursing. All right. And so it's like that with the latex allergies. And there are other industries who also pick up latex allergies, like hairdressers who have to wear gloves and chemicals and things like that. And so I say all this to say Winning Wednesday has been served. Thank you, everybody, for the testimonials. I want to do some questions and answers, and then I want to tell you about V2, the best content-based review. If you are looking for content that will get you to the next level, this is it. Okay. The content that I recommend, this is the one from my program. It helps you pass NCLEX. It helps you pass the exit exams. It comes with only the points. Like if you like quick facts, if you like this book, the quick facts, then you need also the quick lectures to go with it. All right. And I'm just really proud of everybody that came on here and said, hey, I passed NCLEX with V2, because that to me says that you saved time, you got it done, and it was a win. So if you don't have the V2, you can start it. You can start the trial tonight. You can go into the V2 and just get the trial version of it. Do yourself a favor. A lot of people on TikTok, they find me, they do the trial, and then they say, hey, that's it. I'm committing to the V2. So that is the process. Also, I wanted to mention, what did I want to mention? Oh, the calendar. Again, the calendar for V2 has been updated, and it now includes your ability to watch the 30-day challenge videos. Some of you have you're getting the 30-day challenge emails. Also, don't forget, those videos can be found in your 30-day challenge section of V2. All right, so they will be listed there for you. Okay, we also have our success journey for you guys too. It is all there. Okay, somebody just asked me how to study in V2. It is so simple. I say you start with the big 3. The big 3 is your test date. Okay, you got to have, or you should be planning for your test date, because one of the things about V2 is the purpose is for you to get in and for you to get out. Okay, so start with your test date. Then you are going to get the V2 lectures. Okay. You're going to get the quick facts book. Okay. I'm doing a rundown right now of how to study with V2. And you're going to print out your study calendar. Okay. So what did I say? Oh, there's one more book. I forgot. You're going to get either your workbook that looks like this. Okay. Or you can download it. Either way. Your workbook that looks like this, or you can download it. All right. So these are the things that you're going to have with you. It's a very simple program. You watch, you read, okay? You read, and then you answer. A person just did this program literally in a week and a half. I'll tell you how she did it. Sometimes I say I don't know, but she did it because she followed the calendar. Okay. I'm going to show you guys the calendar in a second. But when you're trying to study V2, you have to start with the calendar. So let's look at the calendar. It is in your file vault. Okay. And your file vault is found here. Okay. Your study calendar looks like this. This is the study calendar for V2. Okay. And it will tell you everything you need to do. This is the updated one. So if you go in the file vault, this is the updated one. And so you're going to watch, you're going to read, you're going to answer every day. Now, these sessions should not take you longer than 3 hours. I say 3 hours is the max. It is the maximum you should be doing. So what people do to get through my program is they'll do one study session in the morning and then one study session at night. And there's only 20 study sessions. So you literally, if you do 2 a day, in 10 days, you'll be done. Okay. I know that's how, I don't know how she did it in a week. I mean, but you know what I do know, because she said she didn't work. She stopped working after nursing school. And so all she did was this program. Okay. So she was able to pass NCLEX after trying everything. Check out my TikTok video. Check out my TikTok video that I posted today. You can read her testimony. You can see it there. All right. So this is how you study for NCLEX, literally with content. So let's look at study session number 3. What you would be watching for that day is orthopedics and basic care and comfort. And so that is a video here. Okay. Here's orthopedics. Here's basic care and comfort. Okay. So that's it. Yeah, there's no excuses for you not to be able to do that. So you would just watch those 2 videos. You would read your notes from study session number 2, and then you would answer these 3 exams. Okay. Clinical pharmacology exam, clinical progress exam, clinical pharmacology exam 2. Oh, where's those videos at, Professor Regina? Where are they at? They are right here, right after the video. So you don't even have to go anywhere. Okay. Clinical pharmacology exam, clinical progress exam, clinical pharmacology exam 2. Okay. Super simple. No excuses. Get it done. Okay. So does that make sense? And then once you're done for that day, you're done. You're literally done. There's nothing else for you to do, because you have taken the content in, and you never want to overload yourself. And you guys can see, you know, the videos are straight and to the point. Okay. Very easy for you to do. Very easy. All right. And so the whole goal is, if you have been struggling with trying to get through a whole bunch of content, you've been studying for this test for 3 months, 4 months, 6 months. Okay. You can be prepared. This is a 4-week calendar, how I have it written. It's a 4-week calendar. Can you do this in less than 4 weeks? Absolutely. Do you have to? No, you don't have to. All right. You don't have to. There are some things that you do not have to do. All right. Brush. I say don't cram. Okay. I say don't cram. What makes this program easy is that it has a structure to it. You don't have to feel like you have to go somewhere else for something that you need. Okay. So a lot of people buy UWorld because they want the questions, and they have the questions, but then they're missing content. Right. And you can hear it in the videos. I use this together. I use this together. I use this together. With the V2, you don't have to do that. You don't have to piecemeal multiple resources together, because you have the content, you have the question bank, you have the computer adaptive exam. And like I said, when it is time for you to do everything, it tells you. When it's time for you to watch videos, you watch videos. Okay. Go over here. When it's time for you to read quick facts, it tells you to read quick facts. When it's time for you to answer, okay? It even tells you there's some study sessions where, yes, you go into the question bank. You spend 30 to 45 minutes answering questions, okay? And like I say here, can you do 30 minutes of practice questions? Yes. Okay. Yes, you can do 30 minutes of practice questions. All right. The next day, you're doing clinical subject exams, clinical progress exams. Okay. And so the question is, where should I do the reading? So the reading is going to come from your workbook. So you are reviewing your notes, whatever notes that you took. Oh my goodness, my workbook must have got wet. So like the notes that you take in your workbook, these are the ones that you're reviewing later on. Okay, these are the ones that you're reviewing later on. Okay. Where do those notes come from? And these notes come from watching the videos. So you watch the videos and then you fill out your workbook. Okay, you watch your videos and you fill out the workbook. I like that. Tracy, she says she passed after 20 years. She says, follow the calendar, everyone. I did it twice. I'm addicted to ReMar. She will get you done, period. I used Kaplan 2 times, Hearst reviews in the past. ReMar is the best, the truth. Thank you so much. So Tracy did the program twice. She went through the program 1 time and then she went back through it again. Okay, let's see. Yes, you have access. I'll show you how to get to the question bank. The question bank is here. Okay, it's right here. So you have courses, question bank, file vault. All right. So when you click on question bank here, it will take you to the question bank. Okay. So you would just click on it here. How do you have everything? But I was confusing myself. Okay. Do you understand it now? How do you get this book? I'll show you at the website. You can order this book. But remember, even if you don't order the physical book, in your file vault is the printable book. Okay. It's the printable book. But just for me, I just like to have it right here. Okay. So on the question bank, it will tell you, go to the question bank and you will create a new exam. Here's a question bank. When the V2 access ends, do you still have access to the test that you created while studying? When your access ends, you don't have access to the platform anymore. Does that make sense? Okay. The physical book isn't included. You have to add it on, but I'll show you how to add it on too if you want it and you didn't get it. So this is the question bank. This is where you will create your questions. This is also where you will take your computer adaptive test. Remember, you have 2 computer adaptive tests with the program. Okay. You have 2 computer adaptive tests. So you will find that here. Okay. Computer adaptive tests are very important. I do mention them in the study calendar. I tell you when to take them. Remember, if you scroll all the way down to the end of the session, you're going to take your 2 computer adaptive tests. You will take your computer adaptive test, the first one after study session number 20, and then take this test 1 week before your NCLEX test date. Okay. Keisha, I see your question about the highlighting questions. I'll have to set aside a specific time to do highlighting questions. Okay. Because I won't be able to just signal them out here. Okay, so when you are creating a test, you have to name your test. All right. And Abina says, thank you. And Mark, I passed NCLEX RN, used V2, and quick facts was the bomb. Thank you. God richly bless you all. Okay, pass after the 3rd attempt. I'm so happy. My sister used you too and passed. Oh my goodness, amen. Oh my goodness. Yes. That is phenomenal. Okay, so ReMar, you'll name your test next gen. Okay. Yes, we do have next gen question types. You can do a tutor mode or a test. So let's just do, let's just do tutor mode. And you can also do all the difficulty levels. You can do easy, moderate, or hard. This is a great question. How many questions do you do in a day? It really depends on you. It really depends on the type of person you are. Like for me, I don't have like a set number of questions because sometimes I could do 30 questions in an hour. Sometimes I could do 4 questions in an hour. It just, it just depends. So, okay, you can pick your level, how you want it, easy, moderate, or hard. Okay. You should make a question bank for just the quick facts. Just a section just for quick facts. That's interesting. Taylor says, that's me. I brought Archer thinking it was enough. Bye. You got to get that content. You have to have, it's not just about taking a whole bunch of exams. You definitely have to make sure you have content. Okay, so I'm just going to do next gen question types for you guys to see. And if you have any specific questions about your account, please send me an email, okay? You do get a certificate of completion upon review. All right, you do get a certificate of completion, but you have to complete the entire course. You have to do your coursework, and then you'll be able to turn it in. All right, so let me go into the next gen questions and next gen items. We do have that as well. Keisha says, I do about 25 questions a day. That's plenty. Honestly, I think that's plenty, especially if you're actually reading the rationale. So you can put in the type of subjects that you want to test for. The computer adaptive test is going to cover all of these concepts. So it is best to do questions from the computer adaptive, from all categories on here. You can do timed or untimed. So once you create your test, you just click start test here. Okay. Why is the test name? I'm going to start this test. Why is the test name required? The test name is required because the V2 is going to keep track of all of your tests for you, and it will allow you to retake the test over again or look at the results. Okay. What do you do after test mode? So anyways, you create the test and then you put whether you want it to be timed or not timed. And then the question bank will come up for you. All right. And I think we have this. Oh, there's only one correct option. Sorry. All right, here we go. And so it does have the new question types. It does do partial credit. And it allows you to be able to evaluate yourself. It looks like the actual NCLEX exam, so that's a benefit too. I had a student who had the V2 package, okay, and she only did the content. She sent me a message. She DM'd me and was like, hey, I don't feel ready. I told her, did you do the question bank? She said, no, I didn't do the question bank. I'm just focusing on the content. What happens when you don't test yourself? Okay. You have to have both. Okay. You have to have both the content and the questions. And so she didn't pass her NCLEX exam. She did not pass her NCLEX exam. So what did I have to tell her? I had to tell her V2 is a complete system. Use all parts of it. Use all parts of it, guys. Okay. So I just want to encourage you guys to do that. Do the questions. They're in the calendar. It specifically says there are times when you are supposed to go in here, create tests, period. All right. So yeah. And what I love about V2 is we made sure to put a lot of reading. You have a lot of things to read. You have a lot of things to interpret, because that's how your comprehension and your critical thinking gets stronger. You're going to have the various question types here. Okay. You are going to have all of the next gen question styles. And is the question bank easy? No. Is it supposed to be easy? Yes, when you put it on easy mode. But if you're going to put it in hard mode or moderate mode, get ready to be challenged. Okay. This is the tutorial mode. Yeah, this is the tutorial mode because it gives you the answers. But because this is a case study, you have to answer all 3 questions before to see how you're doing. This is a closed drop down question. Okay. And again, all of these are, the answers are right here. Okay. The answers are right here. But what I'm trying to get you guys to understand is that V2 is an all-in-one system. It's a one-stop shop. It's a one-stop shop. So the content first, though, prioritize the content, because you guys can do these questions all day long if you wanted to, but that's not what I want for you. Okay. I want you to know the content. Is it best to finish the V2 before going to the question bank, or do them both together? Okay. Okay. This is the question that a lot of people ask me. And what do I tell them? I tell them, if you are following this, if you are following the study calendar, it will tell you when to watch lectures, when to read your quick facts, when to answer questions in the question bank. So you don't have to guess what you're doing. You never have to guess with V2 what you are supposed to be doing. Okay? You never have to guess what you're supposed to be doing. Now, some of you guys are using this program in nursing school. I think that's great. I think that's how you're going to get ahead of the curve. But understand that if you're using it to pass your exit exams, you more than likely have a short window of time. You're probably using it 2-3 weeks before your exit exams. So you really have to prioritize being focused and dedicated to get through the program. Okay. I'll say the lectures will help you significantly on your exit exams. Quick facts will help you too, but you probably can't memorize quick facts in 2 weeks. All right. I don't know. It's tough. All right. But if you're using it for nursing school, try to do as much as you can with your studies. Definitely try to do it before your exit exams. Okay. Because that is going to be so helpful for you, that exit exams. No. All right, let me go back to this. So use the calendar. Again, the calendar is going to tell you when to make your first move, when to make your second move throughout the program. I'm just trying to show you guys all the elements that you have available to you in V2. You have a lot of elements. All right. And again, like I said, all question types are going to be here. Just be up for the challenge, because you do have to do this. Amanda, this is a great question. Should you go through every level of questions, easy, moderate, and hard, before you take the NCLEX? I would say do as much as you can. Definitely don't get stuck in one category, because the easy questions are going to cover your fundamentals. I think the moderate questions are going to cover your safety, the safety principles, the things that you must know. Things like how we talked about with when to give a medication, when to hold a medication. That's safety. And then the hard, difficult questions are just going to be really hard, and they're going to be really challenging. And you should expect them, because, that's what NCLEX is going to do. It is going to throw curveballs at you. So the challenging questions are kind of challenging. Okay. Right now on the calendar. Yeah. So no. The quick facts calendar by itself, if you just have this book, okay, then the V2 calendar is very different, because it's going to incorporate my lectures. If you do have V2, then the quick facts calendar is not going to be the best calendar. This is just to read this book. But if you're doing the program, okay, if you're doing the entire program, then this calendar won't get it for you. You need the V2 calendar. Okay. You need the V2 calendar. And yes, somebody did say, and I thank you for putting this down, there's 121 pages in the workbook if you're printing it out yourself. So if you have to go to a FedEx or Kinko's to print this workbook out, it is best that you just have me send it to you, because it's only $35. It's just $35 for me to print this book out. If you have to go to FedEx, Kinko's, well, it's probably just that much, and you still have to bind it or whatever. Okay. So that's that. Let me show you guys how to find this book. So I'm going to go to, I'm just going to Google in my website, ReMarNurse.com. All right. Go to the website, ReMarNurse.com. And if you go, I think you click NCLEX V2. Okay. I'm going to show you how to find the single book. Wait, am I there? Let me see. Is it physical books or is it NCLEX V? Oh, I think, okay, wait. So this is what you have to do. Yeah, you got to select your course. Okay. So the first thing you have to do is select your course, whether you're an RN or PN. Okay. RN or PN. So let's just say you're an RN. Okay. And you can join your V2 right here. You can get quick facts for NCLEX. So everybody should have quick facts for NCLEX. Here you go. Okay. If you scroll all the way down, then you are able to get the single book. right here. So it's at the bottom of the RN or the PN page right here. And then you can just click and add it to your cart. Does this have different things from the physical book? Yes, it does. In here, more of the information is filled out for you, which is what I like. So you have more writing already pre-filled, which means you have to do less writing. And then another thing that this book has is the clinical judgment activity section that's in this book that's not in the downloadable workbook. So that's the difference. Okay. That's the difference. So that's how you get it. Okay. That's how you get it. If you go to the website and you pick your course and you scroll all the way down to the bottom, you can also sign up for the 30-day challenge if you haven't. And I will show you guys how to purchase the V2. Again, we're still doing the sale price for the V2. This is the last month for it. Okay. So this is how you buy the V2, and this is also how you get a free trial of the V2. Buy and get a free trial. If you don't have a free trial of the V2, you can sign up for one now. I'm going to show you guys how to delay your start date, because you can purchase V2 right now and then not start it. Okay, not start it for up to 90 days. Leticia says, I failed NCLEX once. I know that was very devastating. Like, I don't even want to rush past that, because I talked to a lot of people who fail NCLEX one time and then they just say they're not trying again, or, you know, they don't know what to do. So I failed my NCLEX once. I passed my NCLEX exam today on my second attempt. I'm officially a ReMar nurse. I must say, QuickFacts NGN is the truth. V2 and the V2 is the truth. Thank you, Regina, for all that you do. Let me know how it was. All right. Did you have to do a lot of reading, content over questions? I'm so proud of you. I'm so proud of you. Thank you so much for hopping on here and telling me that. Okay, let me see if I can open up a new window, an incognito window. And let me see if I can show you guys a new incognito window. Okay, let me show you how to just delay your start date, okay? Because you might want V2. Let me go to remarnurse.com. So that's the website. Okay. And when you pick your course, whether you're a PN, let's say you're a practical nurse out there. For all my practical nurses, you click on that. Okay. Understand the NCLEX PN faster. Go to Get V2 course. All right. And when you click on Get V2 course, it's going to tell you everything that you're getting, 3 months access, content, next gen question bank, printable workbook. So you're going to get the printable workbook. You're going to get the NGN QuickFacts. Now, if you already have this book, you don't need it again. Don't buy it again with the V2. Okay, I'm going to show you how to take it off of your cart, because then your price goes down even lower. Okay, so if you already have this book and you just need the lectures, I'm about to show you how to do it. So you go to Buy Now. All right, so you click on Buy Now and it will have you fill out your account details. But over here, okay, you can even add your NGN. You can add your NGN here, okay? You can add that, and I'll print that out for you and send it to you. So you're going to get 2 books. You're going to get QuickFacts, and then you're going to get your question bank, okay? I'm sorry. You're going to get your QuickFacts, and you're going to get your printed workbook, okay? So you can add it right here. If you also want the first shift book, or you can get this book as well. This is how to dominate your first 2 years in nursing. So this is how you apply yourself to the job. So you can have I want you to have the nursing career of your dreams. Okay. So I'll cut out the learning curve. So that's a lot of my on-the-job training information. So you can add that book too. Now, if you already have QuickFacts and you don't need it, you could take it off. Most of you guys have QuickFacts already. Okay, so just take it off. And if you don't want me to print out the workbook, you want to print it out yourself, you can go ahead and take that off too. And so that will bring your price down to $69. V2, $69. All right, so down here is where you delay your start date. So say you want to purchase V2 tonight, but you don't want to start it tonight. or you don't want to start it next week, you can click that little calendar button and you can move it all the way out until October, like the middle of October around Halloween. All right. And so that is a long ways away, but you are still able to, study. You can change the date. If you thought maybe you wanted to start later, but then you want to start again, you can change that date. You get one opportunity to delay your 90 days. Okay. So that is how you do it. Does that make sense? All right. So that's how you do it. Maria says, a lot of comments. Miss Regina, if I'm buying the V2 and delay to 90 days, can I still access during these 90 days to study at a lower pace? So if you delay your access, you cannot access the lectures or the V2 question bank, but you will have your quick facts book. Does that make sense? So you would still just be studying your quick facts book. Now, if you change your mind and say, hey, I actually do want to start now, you can jump into the V2 and you can start, but you can't delay it and then still access the V2. It won't let you in. All right. Oh, does that make sense? Okay. This is a question about subscription. Hi, my V2 expires August 13th. What do I do? So you have about another month to study. If you don't do anything, your V2 will automatically renew itself. Okay. It will automatically renew itself. So you don't have to do anything. If you don't want your V2 automatically renew itself, then go into your account and cancel the subscription, and then it won't renew itself on August 13th. Okay. What is the benefit of delaying the start? First of all, it's for you to get the sale price, because the sale price is changing at the end of this month. Remember, we extended the sale price for the month of July. We had like 500 students get in the final day, 3,000 got in June. So there were people who didn't get a chance to get into the V2. So we said, we're just going to extend the sale. Okay. So that is the benefit. If you get it on the sale price for $89 for 3 months, then you can start it in August, or you can start it in September or October. Okay. That's the benefit. Is the book good for next gen? Everything is good for next gen. Everything has been fitted and designed for next gen NCLEX. These people that are passing with V2, they're taking the next gen NCLEX. Okay. All right. Marietta, do the workbook come with the package? Because I didn't get the workbook. Yeah. So the workbook is an add-on. You only would get this if you paid the $35 for me to print it out and send it to you. Otherwise, you got this book. It's in your file vault. You can go print that out at any time. Okay. You can get that at any time you want to. It's there for you already. Just the printed workbook is extra. And I didn't have this at first. When I first launched the V2, I didn't have a printed workbook, and y'all fussed me out so much and was like, we want a printed workbook. So here it is. I was able to release it so you guys can get it. But for the $89 package, you're getting the Quick Facts physical book and the downloadable workbook. Okay. I'm next to pass my NCLEX RN. I know that's right, Agnes. I know that's right. I'm waiting for your testimonial. I'm waiting for all of you guys. Okay. I'm waiting for all of you guys. And that's why I'm asking you. I am asking you for the minimum. If you think about all, everything else that we invest in, and this is what I say, everything else that we invest in, if you guys invest 89 $1 bills, 89 $1 bills into your preparation for NCLEX, I promise you 2 things. Okay. Number 1, I promise you, when you pass this test, you never have to take it again. That's it. You do one and done. Okay. It's worth the $89. And then the second thing is you will get that $89 back when you become a nurse. And it will come back to you so quickly. In the very first day that you start working, in the very first day that you start getting job opportunities, it will be worth it. Okay. It will be worth it to you. I promise you it will be worth it. Okay. if I fail the CAT exam, can I still take the NCLEX? I can't take the NCLEX. No. So there's 2 CAT exams in your V2. Take the first one, see how you feel. Some people don't pass on the first CAT exam. That's okay. Remember, this is all about learning. This is all about preparation. Most people, if they don't pass on the first one, they pass on the second one. And I think people have to go in there with the expectation that V2 is to prepare you for NCLEX. So I know there are other, people call them CAT exams, computer adaptive exams, that you have purchased in the past, and you're able to get in there and basically do what you want to do. You're able to start a CAT exam, pause it, skip questions if you want to, come back to it. Not the CAT exam. The CAT exam that we have, you have to treat it like the real NCLEX. It is going to challenge you. So if you don't pass the first one, take it again. Take the second one. All right. You gotta look at the content, get back into the question bank. If you don't feel like you're doing as well as you should be doing with the CAT exam, get back into the question bank and work through those questions. There are 2,000 questions in the question bank that are not in the CAT exam. They are totally separate from the CAT exam. So work out the questions, because it could be an issue of, you know, the content, but you're not reading carefully. Or once you read a certain amount, you have a hard time holding on to it. And so, yeah, you focus at the beginning. It's what happened last night. You focus at the beginning, but by the time you get down to the 5th and 6th sentence or the 2nd paragraph, then you start to zone out or you start to overthink it. Okay. And so all of that is work that has to be done. This is a training. You being a nurse is a training. So you can't open up a patient's chart in real life, only be able to focus on the first 3 sentences and then zone out or, you know, become distracted. Like, it's preparation for the real grounds. Okay. Preparations for the real grounds. How many questions are in the CAT exam? I don't know. There's a pool. There's probably a pool of like 600 questions or so. And so the CAT exam is not going to give you the same exam twice. It's just going to behave like the NCLEX. So you're going to see different questions in that exam. So yeah, you take 2. Yes, there is a limit to how many times you can adjust the start date. You can adjust the start date 1 time. Okay, 1 time. Okay, guys. So now is the time for a lot of you to do 1 or 2 things. You're either going to get into the V2, all right, go back to studying. You have the program. Maybe you didn't know there was a study calendar, so you're going to print out the study calendar. Maybe you didn't know there was a downloadable workbook. You need to print out that downloadable workbook. It'll make a difference in how much you retain. Okay. Get back into the question bank. You need to study questions, or you need to take a computer adaptive test. One of you are in this group. There's only 1 or 2 groups. The second group is you don't have the V2. You need to get into the trial version of the V2. Okay. Get in the trial version, because it's going to make a difference in how you are engaging with NCLEX content. Okay. It's going to make a difference. And to me, if you have another NCLEX review, but you still have to come to ReMar for content, that tells me you're not working the program that you have, or you are not, it's not serving you. Yeah. You're not connecting with it. And that happens so much. Okay. Will we have to sit the entire 200 questions at once? No. The computer adaptive exam, no. The computer adaptive exam is not going to do that. It is going to give you the minimum questions, okay, until you have determined that you are able to pass or fail the exam, but it's not going to go over the maximum number, okay? So it's just like the NCLEX. You don't get 600 questions with the NCLEX. You won't ever get 600 questions with my computer adaptive test. Another thing about my computer adaptive test is that you're going to get a pass or fail printout like the NCLEX exam. You're not going to be able to go over the questions. It'll tell you the categories that you did. I'm going to show you what one looks like. All right, so it's just like you probably can't see it, but it has here whether you passed or failed, and then it has the categories that you passed or failed with. Okay. And so that is how I keep the integrity of my CAT exams intact. That is how I keep your experience realistic, okay, to the actual NCLEX. That's what I'm trying to do. I'm trying to prepare you content-wise and mentally for this exam. Okay, don't give up. Okay. Yes, of course, you're still benefiting from not purchasing, even if you don't have a physical copy. The physical copy, like I said, it's a bonus. I only did it because you guys asked me for it. You guys asked me to have a physical copy of the workbook because you didn't want to print it out or whatever. You just wanted to buy it with the thing. Okay. So that's why I printed it out. But before this, months before I printed out that workbook, people were still passing with the downloadable workbook. Okay. So don't feel pressure to the V2 is the most important. If you have the V2, you have access to the downloadable workbook. You have access to the question bank. You have access to the computer adaptive exam. I am happy and excited for you. I actually can't wait for you to take your NCLEX. You guys have a lot of anxiety, but for me, I am so looking forward to it. Most of you guys who are in V2 and working it and doing it, you could take your NCLEX tonight and pass it. You're doing the work. This is not anything. If you're doing what you're supposed to do and you're making strides in my program, you're ready for NCLEX. I'm excited for you. Get ready for it. Get ready for the challenge. You got this. You got this. Don't take yourself out the game. Don't psych yourself out. Don't let anxiety make you feel less than confident if you're doing what you're supposed to do. Okay. Yes, you have access to the computer adaptive exam your entire time that you have subscription access. Okay. The entire time you have subscription access, your computer adaptive exam is there. Please follow the calendar so you know when to take it. Felicia says, I made up my mind to get back into studying for the NCLEX. Thank you for the inspiration and motivation to keep going. I'm not giving up. Please don't, because with God is possible. Okay. With God is possible. Remember, the computer adaptive exams are in the question bank. So if you go to the question bank, you'll find your computer adaptive test there. It is a category of tests that you can create. All right, guys. Okay, I'm going to get out of here. Please, guys, 1 or 2 categories. You're either in V2 or you're in the trial of V2. One of those things. Okay. Why do you say that? Why are you saying that? I wish I knew about your program. Now I'm screwed. Why do you feel that way? Let me know why. Because you can still benefit. You're here in the ReMar community. Just you being here is literally changing your mentality of how you approach the exam. Okay. You see people's comments, you see the testimonials. You can do this. You can do this. All right. You're here for a reason. You're here for a reason. Good night, everybody. Okay. Good night, everybody. That's not the close. All right. Put the script on. You guys know my script. Mark says do the official ReMar close. I will be back on. I relied on Q banks. Oh no. So I see. No, I can't leave because I relied on Q banks. I'm weak on content. See, that's it though. That's it. You came here tonight because you're not supposed to make the mistake that other people make. You relying on Q banks. I can't blame you for that. That's what people tell you to do. They tell you to just do questions. But look at you. You've made a realization that you want to do more to prepare. So just do more. Don't change your test date and do more. Don't just go in there defeated. Okay. Don't go in there wishing you had done more. Do more. Okay. This is a big test. So do what you got to do. Okay. Do what you got to do. Get in V2 because you'll get the content. All right. All right. The official close. Where is it at? I thought somebody had it. The official close. Here it is. Here's a new official close. Content. Close. That's close. All right. I like this, Felicia. You got it. I can, I will, and I must pass NCLEX. I'm going to pass. Just say that to yourself. Write it down somewhere and believe it, okay? Because with God, it's possible. Say this. I can, I will, and I must pass NCLEX. See you guys later. Bye-bye.